Hi, everyone. Dr. D here. Thank you so much for taking the time to join me today. And as you know, we're on a bit of a journey here, traveling beyond medicine, exploring a new way of thinking. And today we're going to be visiting the world within vicious cycle disorders, known as repetitive thought disorders. But before we do, I want to take the time to share a little housekeeping with you, clean up some details, address some of the emails, the phone calls, the feedback that I've gotten over the last few weeks and since the last live video. First and foremost, I'm not here to convince you of anything. I'm here to share with you and to expose you to a new way of thinking about things that I've been exposed to over the last 40 years, having the privilege of working with close to 10,000 people a year over the course of 40 years in over 55 countries, using an evaluation process that I developed many years ago called the Matrix Assessment Profile, or the MAP. And as you know, for those of you that have not been here before, I'm Dr. Richard DiCenso, known to most of my patients as Dr. D. And I am the CEO of Matrix Transformation, the creator and developer of the Matrix Assessment Profile. Now, some misconceptions that I may have led you to believe are the fact that the Matrix Assessment Profile is a test, when in fact it is not a test. It is not as simple as, well, let me run some fluids and let me get the results and tell you that you have elevated cholesterol, for instance. It is an evaluation process, which means that it is not an event. It actually is a process when we come to not only determining what the cause of your chronic and unresponsive symptoms might be, but also as to what the solutions might be for the symptoms that you suffer from on an ongoing basis. And then there's the concept of chronic symptoms. What does that mean? Well, it simply means that it's something that disturbs you, that you've been experiencing over an extended period of time that doesn't seem to get better, and sometimes it gets worse, but nothing you do seems to affect it in any productive or positive way at all. So typically, this is the individual that's been everywhere, done everything, seen everybody, and many times has been told, look, we can't find anything wrong. The symptoms are normal for your age. We're going to have to run more tests. Well, we're going to have to wait and see. Or the symptoms are all in your head. And oftentimes this last statement, the symptoms are all in your head, is probably closer to reality than a lot of us take the time to think about, because we rarely take the time to think about what we're thinking. But today we're going to think about our thoughts. Now, another key factor here is a lot of the emails I've gotten since the last presentation revolve around the concept of symptoms. So in other words, you've sent me emails saying, Dr. D, what do you do about? What have you got for? I have this, I have that. What is your solution? Well, the bottom line is I don't know what the solution is to your particular set of symptoms. And my perspective, and again, you don't have to believe this, you don't have to accept it, and you don't even have to listen to it. You can click off now, but I'm sharing with you what I've learned over the past 40 years, and that is the fact that most diagnoses are diagnoses of symptoms, and that includes things like hypertension, diabetes, IBS, osteoporosis, arthritis, just to name a few. Now, why do I call these symptoms? Because they're typically the result of an underlying cause that's been unidentified or misdiagnosed. And in either of those cases, it's going to require looking at things that nobody else is looking at in ways that nobody else is looking at them. Now, key components of the matrix assessment profile are urine and saliva. This is a biological fluid analysis. And so the concept is you decide that you want to have this evaluation performed. You order the kit. We send it to you, prepaid round trip shipping. You provide samples of urine and saliva in the comfort of your own home, send them back to my office. We run them through a quantum fluid analyzer. And in the last 10, 12 years, we've incorporated a mathematical algorithm into the software that predicts the likelihood of what the blood findings might be if we had a live blood sample. And part of that algorithm was based on the fact that we ran about 1,000 live blood samples against the algorithm until we had it accurate within 1%. So it's for the most part extremely accurate. So we have urine, we have saliva, we have blood findings, and they're measured in 0.01 increments. And the significance of that is for every 0.01 deviation from normal, it represents the presence or absence of about 6 billion molecules of whatever we're looking for. So when we're looking at pH, when we're looking at RH2 or oxidative stress translated to free radicals, when we're looking at resistivity translated to mineral balance in the body, we're looking at it far beyond the capabilities of a dipstick. We're looking at it in 0.01 increments. So it's highly sophisticated and it's extremely accurate in terms of its measuring capabilities. So now we have the results of a biological fluid analysis, and you have these symptoms. Most times they're chronic symptoms that just aren't improving, aren't going away, oftentimes getting worse. So what do we do about that? Well, there are a couple of other components to the assessment profile, which is why it's a process. There's a health history form. What is it that you've been through? What have you been exposed to? What diagnostic procedures have you been through? What kinds of medications have you been prescribed? What basically have you done in regards to identifying the cause of these chronic symptoms? Then we have a personal health history, which goes into detail about different aspects of your life, your beliefs, your behaviors, your diet, your supplementation, anything about you that makes you you. And this is because of something that Hippocrates said a long time ago, and that is the fact that it doesn't really matter what the symptoms are. It doesn't matter what the disorder is. It doesn't matter what the disease is. It doesn't matter what the diagnosis is. What matters most is who it is that's experiencing these things, meaning the symptoms, chronic, non-responsive disorders. Now, once we're involved in the results of the biological fluid analysis and we integrate some of this other information, we're doing it within the context of the fact that over the last 40 years, I've identified 3 major areas of influence that impact what we're going to see in the biological fluid analysis. That I call these realms, and these realms include things like the structure of your body, the weight, the actual musculature, the fat content, the muscle content, the respiratory posture, the posture in general, then the biochemical realm. Things like, what are we seeing in the biochemistry? What things are normal or abnormal in the biochemistry? Oftentimes you'll provide me with lab work that's been performed over a period of time that simply identifies the effects of some undiagnosed cause that's creating the imbalances in the biochemistry that are resulting in physical or physiological symptoms in the body. And then we have the virtual realm, which we've been talking about over the last couple of sessions. Now, within this realm, we have the unseen, we have the psychological, we have the emotional, we have the spiritual, all potentially impacting what we're going to see in the biochemistry and subsequently as part of your physical experience. So how do I go from biological fluids to the virtual realm? Well, it's quite simple, but we have to be aware of certain other concepts because it is not as simple as if A is present and B is present, then C must be the cause. This is an integrated approach, and it's got to be integrated in terms of how we evaluate the biological fluid results, meaning that we have to take into consideration some of the concepts from other areas and other specialties, particularly from quantum physics. So I'm going to say a few things here that are relevant, and I'll show you how they're relevant as we go through this discussion. What you focus on expands. Energy flows where attention goes. When you change the way you look at things, the things you look at change. You and I are the biochemical end product of our interpretation of our perceptions. Now, all of these are important as part of the evaluation process, because if we're dealing with something like developmental trauma, shock trauma, as part and parcel to the physical symptoms that have developed over a period of time, then obviously, until and unless we identify and address the trauma itself, the impact, the effects of that trauma over a period of time, then regardless of what it is that you're prescribed, you're never going to solve the problem. You're not going to identify a solution. And the whole point of what I do every day is to identify the cause, turn those symptoms into solutions. In doing that, we have to ask one very important question. This is a question that I started asking 40 plus years ago that drove me crazy initially. And that question is why? Why? I was involved as part of a very unique internship program at a hospital in California called Cedars-Sinai. And it was an internship that was initially developed to determine what the value, what the benefits were of any of these alternative techniques. So everyone in this internship program had some alternative perspective. There were acupuncturists, chiropractors, medical doctors who practiced homeopathy, dentists who didn't work on teeth, they worked on manipulating cranial bones, massage therapists, color therapists, just to name a few. And the question why for me came up when two people with the same symptoms, same sex, same socioeconomic background, same age, had the same symptoms, were prescribed the conventional state of art care. In other words, the standard of care within the conventional model of thinking. One got results, the other one got none or got worse. The response I got to that question was, well, you need more experience. Well, you'll learn as you go along. Some things are unsolvable. We just don't know why. You need more education. You need more training. And so I went off on that path for a number of years into trauma rehabilitation, into orthomolecular nutrition, into numerous alternative therapies and approaches, into naturopathy, into homeopathy, into clinical nutrition, and even into forensics. I spent 10 years as a forensic examiner, realizing that I still had to ask the question why, and that question being unanswered. And in the process of acquiring all of these credentials, this additional education, this additional experience, I realized that I was also developing perspective. At the same time, since there were no real personal computers available at this time, I was experimenting with fluids in my little personal lab in many of my offices that involved a urine sample. It involved saliva. Some of it was a dipstick. Some of it was chemicals that I would drop and titrate into these fluids, blood spinning, evaluating what I could in each of these fluids with the tools that were available, and then hand calculating these results, and then making a decision about what the significance of those were relative to the symptoms that someone was experiencing. Needless to say, this was a little primitive, but it did help me to develop the mindset that I bring to the table when I'm evaluating the cause of chronic and non-responsive symptoms. Now, I hope this gives you a flavor for what this entire process is about. Now I want to help to provide you with an understanding of what it is that I do and why it is that I arrive at the opinions that I do, and why it is that those opinions have some validity in terms of the science behind the science as we know it. Now, I mentioned a few concepts early on with what you focus on expands. Nothing exists until you observe it. Energy is not created or destroyed. It simply is transformed. Energy flows where attention goes. When you change the way you look at things, the things you look at change. So here we are in the virtual realm. We entered into the world of vicious cycle disorders, which is just another way of saying chronic and non-responsive disorders. It's a vicious cycle. But the vicious cycle does not typically involve just two things. It's multifaceted, meaning that there are influences from the biochemistry that feed back on the original cause. There are issues with the structure that ultimately develop and feed back on the biochemistry. There are issues associated with our interpretation of our perception in our day-to-day life experiences, because as I stated earlier, you and I are the biological end products of our interpretation of our perception. Herein lies one of the keys to identifying repetitive thought disorders as a primary cause of vicious cycle disorders, of chronic and non-responsive symptoms. So why do I say that? Well, you know, the concept of thoughts becoming things has become almost cliche. In the sense that it's been misrepresented to a large degree by a lot of marketers who have gleaned onto the concept of, wow, thoughts become things, so just think positive and you're going to manifest whatever it is that you think about. And, you know, that's the concept behind the New Year's resolutions. If you exercise, you'll get fit and everything will be perfect. If you do the diet, jump right to that last step and do the diet. I'm going to lose weight, but then you fall off the wagon in both instances. And the intended outcome never really occurs. And if it does, it's temporary. Same thing with symptoms. So identifying the degree to which repetitive thought disorders are causing or contributing to your symptomatic experience is critical, in the sense that thoughts can become things. They don't necessarily become things or the things that you want, but they can become things. The formula is relatively simple. Thoughts, feelings, emotions, actions, results. That's the basic formula. That's the basic recipe. It's no different than buying the ingredients for something that you want to have for dinner and assembling those ingredients, purchasing those ingredients, bringing them home, integrating those ingredients with the intended outcome of having whatever it is that those ingredients represent in terms of a recipe. So the recipe is thoughts, feelings, emotions, action, and result. So expanding on that just a bit, any thought that you hold for an extended period of time is going to produce a feeling. Any feeling that you experience for an extended period of time is going to produce an emotion. An emotion that you contribute to, experience, or glean onto and enhance in some way, shape, or form, experience in some way, shape, or form. over an extended period of time is not only going to produce biochemical effects, but it's going to produce the desire to take some form of action. And then another concept from conventional physics, Newtonian physics, for every action there's an equal and opposite reaction. And from a concept taken from my most recent book, Beyond Medicine, Exploring a New Way of Thinking, in the introduction, I talk about something I talked about on one of the previous calls, that being several guidelines that you could actually use to determine where you needed to go next. What was the most effective next step for you? And one of those concepts also dealt with a variation of this Newtonian theme. The Newtonian theme, once again, being for every action, there's an equal and opposite reaction, when in reality, for every action, there is a reaction, but it's not necessarily equal and opposite. Which means that there are other components that need to be considered and need to be integrated into developing a solution for the symptoms. So now we have the recipe, we have the expanded version of it where we've reached the point of taking action, and that action repeated over a period of time with the intention of achieving a particular outcome or result is going to produce a thing. So yes, the thought ultimately did become a thing, but the thought doesn't become a thing. Another caveat, another guideline in the introduction to my last book, simply that everything is what it isn't. Thoughts are things, thoughts become things, and yet they don't really. There's some middle ground there that is the fly in the ointment that is frequently ignored and often misrepresented simply because it's much easier to adopt a concept, a belief system, that positive thinking is going to solve it all. It's a contributing factor to this process, but it's not the solution. Visualization, same thing. Many of the tools, techniques, and strategies associated with changing your mindset, same thing. Very productive, based on another caveat from my book. Everything works, but everything works most effectively when it's applied to a specific set of circumstances for which it's indicated. Leads us to another caveat, another guideline. There are no panaceas. To another concept, another guideline, another caveat. When you hear hoofbeats, look for horses. Start where you are, deal with the obvious, and work backwards. So if it's a simple auto accident with a broken arm, you don't really have to look beyond that unless it becomes a series of car accidents that you're contributing to or causing on a psychological, emotional, a thought level for some other reason, which obviously does need to be dealt with, considering that virtual realm possibility. But essentially, you go, have that dealt with, it's done, you recover, you return to your life. Now, what are the things going on physiologically that may be associated with repetitive thought disorders? Well, there are two concepts that are related here that you need to be aware of. Now, based on the best recent estimates, we have 50 to 70,000 thoughts a day. 90% of those thoughts are the same thoughts we had yesterday, and 90% of those thoughts are negative. So we already have a negative bias built into the brain. So what happens with that bias? You begin to look for evidence to support what it is that you already believe, and you look for ways to discount anything that may create conflict or controversy in regards to what it is that you believe, which means that you're looking for a way to discount anything that obviously may be contrary to what it is you already believe, that may in fact have the potential to guide you from symptoms to solutions. Now, what happens biochemically is very similar. We have to talk about stress here for a moment because it's one of the key core essential elements in terms of our response to chronic and unresponsive disorders. Now, there are many other things that occur in the biochemistry. Many of them show up in the biological fluid analysis associated with the matrix assessment profile, things like alterations in the pH, acidity, toxicity, mitochondrial compromise, energy production, free radical content in the biological fluids, nutrient deficiencies, blood being diverted away from digestion, causing malabsorption syndromes or contributing to them, lymphatic congestion, the waste product removal system in the body being overwhelmed, liver and kidney compromises, so many things that show up in the matrix assessment profile. But given all of that, we still are confronted with the question of why. So when I get an email that says, well, I have this, what do you do about that? The answer is really always the same. I hear hoofbeats. I look for horses. I start where I am. What are your symptoms? What's your history? What have you done in response to these symptoms over a period of time? What results have you gotten? What's worked? What hasn't worked? And then how does that compare to the results of the biological fluid analysis? Taking all of these things into consideration, then I begin to develop a set of recommendations with the specific intention of guiding you through a process that is designed to turn those symptoms into solutions. Now, back to stress for a moment. One of the things, and one of the most important things that happens is in the stress systems in the body. And this too is multifaceted. We have the dysregulation of the central nervous system, the two components being sympathetic, the gas pedal in your car, the parasympathetic being the brakes. We have things like production of stress hormones, the two most important being adrenaline, also known as epinephrine, and cortisol. Now, why are these important? Because they're produced within seconds of a perceived threat. Once again, we're the biological end products of our interpretation of our perception, which means we've interpreted a perception of a particular circumstance event. We've interpreted it to, in large part, within the context of the negative bias of our brain. So we perceive a threat to our well-being, to our livelihood, to our comfort. In perceiving that, interpreting that perception, we stimulate the production of adrenaline, epinephrine, and cortisol. So what? Within 3 seconds, our bodies are designed to tolerate this initial response to someone jumping out of the bushes, someone following us up a dark street, someone cutting us off in traffic. Within seconds, adrenaline, cortisol produced. Within 3 minutes, the adrenaline's metabolized out of the body. Within 20 minutes, cortisol metabolized out of the body. The cortisol cycle is well known. Between 4 and 8 in the morning is when it's at its lowest, when we're in the rapid eye movement portion of sleep. And then between 8 and 10 at night, it starts to fall off. So as we prepare for sleep, the cortisol dissipates. Now, we're exposed to something repetitive. What is it that these two hormones have in common? One of the things that they have in common is thoughts. Thoughts being something that we experience every day on a consistent basis. So the majority of what it is that you are thinking on a day-to-day basis can, in fact, be a trigger for the production of adrenaline and cortisol. So what? Adrenaline and cortisol are not designed to be present in the body over an extended period of time. Why not? Because they produce vast physiological compromises and damage to virtually every system in the body, to the bones, to the musculature, causing the environment to be present that will allow for genes to become active associated with mutations that you may have inherited, contributing to the production and accumulation of corrupted mechanisms associated with diabetes, with high blood pressure, autoimmune diseases, kidney failure, suppression of cells, the immune cells, suppression of the stem cells, osteoporosis, just to name a few. So these symptoms typically are diagnosed as a disease when in fact they are an effect of something much more long-standing, oftentimes associated with extended production of epinephrine and cortisol. So your body is not designed to tolerate these two hormones over an extended period of time. And the fact that these two hormones are directly associated with thought is even more of a fly in the ointment, because as I said early on, we typically don't take the time to think about our thoughts, think about what we're thinking. And so we are left with that fundamental recipe of thoughts translate into feelings if paid enough attention to. What you focus on expands. Feelings, if paid enough attention to over an extended period of time, produce emotions. Energy flows where attention goes. Emotions, when expressed and entertained over an extended period of time, produce actions or produce the desire to perform an action. That action ultimately results in an end product, a particle. Nothing exists until you observe it. Collapsing waveforms into particles, part of the quantum physics concept that we've talked about ad nausea over the last few sessions, based on the double slit experiment that I suggested you take a look at. Google that experiment, but then look at the results and see how it is related to and associated with everything that I'm discussing today. So even though this all seems random, it may seem overwhelming, it may seem confusing, all of these things must be taken into consideration if we are in fact going to ever be able to identify the cause or causal factors associated with chronic and non-responsive symptoms. Now, if you're interested in expanded dialogues concerning any of the things that I'm talking about today, every week I produce an audio for our members in our membership site dealing with these topics in detail. And over the past couple of months, for instance, I've spent 4 or 5 weeks talking about a 5-step process for consciously contributing to creating the experiences that you intentionally want to have. And it begins with something as simple as taking responsibility, which was basically a whole hour-long discussion. And then in the next discussion, we talked about investigate and eliminate, which is essentially thinking about the thoughts that you're thinking. And then it goes on from there to create a plan, in other words, taking action. And then this 5-step process, among all of these other things that I'm discussing with you today in brief, are discussed in detail on the membership site. So if you're at all interested in expanded conversations, please take a look at that. But also in the over the course of the last several years, probably the last decade, I've created tools that will facilitate the alteration of things like the 5 brainwave frequencies associated with the production of cortisol and adrenaline over an extended period of time. We know these to be delta, theta, alpha, beta, and gamma. One of the simple tools and strategies is a personal EEG machine that I've also discussed in detail in prior audios. I'll be talking about the solutions to everything I'm discussing today in our next video. One of the other solutions or potential solutions is a series of audios that I created where I've embedded deliberately specific brainwave frequencies along with a dialogue that is associated with what it is that you want to accomplish, So your brain is automatically entrained in a productive brain set of brainwave frequencies that will facilitate the production of alternative thinking associated with what you would like to experience. And then for those of you that are more interested in extended versions of that concept, I've created 2 sequential 6-week courses called the Neuroscience of Successful Change, based on a simple concept: ask, believe, receive, and take inspired action. Very closely aligned with what happens with a thought, which leads to a feeling, which leads to an emotion, which leads to an action, which leads to a result. Now, in a lot of what I just described in terms of what it is that I created and why I created it is also based on some research that was done by NASA within that same period of time. And essentially what they did is they had the astronauts wear a pair of glasses that inverted everything. So everything they looked at all day long was upside down. In order to acquire the ability to see everything through the upside down glasses right side up, they needed to develop new neural pathways associated with what they were perceiving and how they were interpreting that perception via the eyes. And on average, it took somewhere between 21 and 46 days to develop the neural pathways associated with changing the structure and the function of the brain and the associated brain waves that would be consistent with an intended outcome. So I've used these brainwave frequencies. I've used the concept of neuroplasticity. I've used the concept of changing the structure of the brain, and I've used the concept of modulating the various brain frequencies known to be associated with various thoughts, feelings, emotions, and actions, taking us out of the realm of what they call high beta, which is high stress and anxiety. Typically, it's the monkey mind that we immediately begin to function with each day. So part of the concept in terms of incorporating potential solutions into a daily discipline is actually creating a plan, implementing that plan, taking that action, and being consistent with it. It can be as simple as getting up in the morning before you get into beta, going somewhere quiet in your home, your house, your apartment, your tent, and sitting quietly. Focus on your breath, meditation, contemplation, prayer. Whatever the tool or technique or strategy you feel most comfortable with, whatever resonates with you is the tool or strategy you want to use, because anything can cause anything. So how do you know what's causing what? And everything works. But everything works most effectively when it's applied to a specific set of circumstances for which it's most indicated. And in many cases, the circumstance for which it's most indicated is not your symptom, it is your belief. So find something, regardless of whether it involves me or the matrix assessment profile, that is consistent with what you think, consistent with what you believe, that is resonating with your thoughts, your beliefs, your behaviors, but do it. Do it on a daily basis. Experience the fruits, experience the results of your dedication, of your commitment to a process that you've designed. You've incorporated all of the things that you believe are going to benefit you long term, but you need to be consistent. You need to develop the same impetus. You need to propel yourself forward on a regular basis, because what you focus on expands. Energy flows where attention goes. So divert, redirect what it is that you are thinking, feeling, the emotions that you're experiencing, the actions that you're taking on a day-to-day basis with the intended outcome of experiencing what it is that you want to experience in your day-to-day life and break that vicious cycle of repetitive thought disorders. Now, I trust that all of you haven't clicked off at this point. I trust that you found some value and some interest in what I've shared today. If you have, great. One of the possible actions is get online, go to mymatrixmap.com, order the evaluation kit, the matrix assessment profile for yourself, and decide for yourself if this has any value, if it has in any way, shape, or form is going to contribute to resolving your chronic symptoms, turning those symptoms into solutions. If not, that's okay. But do find something that's going to work for you. Otherwise, you're going to be trapped in this vicious cycle disorder for a long time, if not for the rest of your life. You're going to be trapped in this repetitive thought disorder syndrome for an extended period of time, if not for the rest of your life. So all I'm saying is take the first step, do something, take inspired action. If you're so inclined and you're not sure, most of what I've discussed with you today is in fact contained in my most recent book, Beyond Medicine, Exploring a New Way of Thinking. Please join me there. If not there, and you're still not sure, join me on the membership site, where every week I provide you with these expanded dialogues in the form of audios specifically for our members, but also every week on Wednesday at the same time, I get on a call live for 1 hour with all of the members of this site to discuss anything that you want. So it's an additional opportunity to interact with me, ask me questions, challenge my beliefs, which are simply the result of experiences developed over a period of 40 years now, and communicated to you in a form that I experience as coherent and that makes sense to me and means something to me, and I'm simply sharing those thoughts with you and exposing you to a new way of thinking beyond medicine. So if any of that works for you and you don't want to jump right to the evaluation process, by all means, that's a great way to start with the book, with the membership site, with the matrix assessment profile, or clicking off, never hearing from me again is cool too. But in any event, I'm going to be back in 2 weeks with an expanded discussion of everything that I've talked about over the last few videos. And we're going to be delving a little bit further into the biochemistry, into the virtual realm, and into some of the possibilities for turning your symptoms into solutions. So until then, I'm Dr. Richard DiCenso, Dr. D now, hopefully to most of you, and I'll see you again in 2 weeks. Thank you for watching.